If you're over 50, what I'm about to tell you might sound completely backwards. Research on aging circulation shows that consuming ordinary tap water without strategic modification can reduce effective oxygen delivery to your tissues by up to 74% when compared to enhanced hydration approaches. I realize that statement seems to contradict everything we've been taught. For decades, medical advice has been simple: drink more water, improve your health. But when we examine what actually happens inside the aging vascular system, the picture becomes far more complex. After your 50th birthday, your cardiovascular machinery operates under entirely different rules. Vessel elasticity diminishes. The body's ability to produce molecules that relax blood vessel walls drops dramatically. Your cells lose their ability to squeeze through the tiniest capillaries efficiently. When plain water floods into this compromised system without the proper biological cofactors, it can paradoxically dilute critical minerals, suppress the signals your vessels need to open properly, and leave you feeling just as sluggish as before you drank anything. This explains why countless older adults guzzle water religiously yet continue suffering from icy fingers, leaden limbs, lightheadedness, mental cloudiness, and relentless exhaustion. The hydration is present, the circulatory activation is absent. What shocked medical researchers is that subtle modifications to water consumption triggered measurable improvements in blood velocity within 5 to 30 minutes in clinical observations, occasionally matching the short term effectiveness of pharmaceutical circulation enhancers. These alterations influence blood thickness, the health of vessel linings, and how efficiently oxygen reaches distant tissues almost instantly. No medications required, no doctor visits necessary. Simply more intelligent approaches to staying hydrated. In this video, I'm going to walk you through 5 surprisingly simple yet rarely mentioned water modification techniques that clinical studies suggest can accelerate blood flow rapidly in people over 50. We'll count down from the least to most impactful. Some might seem almost embarrassingly basic, but the biological mechanisms powering them are remarkably sophisticated. My name is Dr. James Whitemore. For the past 12 years, I've specialized in geriatric cardiovascular medicine, focusing specifically on how circulation deteriorates with age. What I'm sharing with you today represents a protocol I now discuss with virtually every patient over 50 who walks into my office complaining about cold extremities, chronic tiredness, confusion, or sluggish circulation before I ever reach for a prescription pad. Stay through all 5 techniques because the final one on this countdown is the single most misunderstood strategy, yet it delivers results in under 60 seconds. Before we dive into these 5 techniques, you need to grasp what's genuinely occurring inside your circulatory system past age 50. Because once this becomes clear, everything else will click into place immediately. Your blood isn't just colored water. It's an incredibly intricate mixture of cellular components, specialized proteins, essential minerals, and chemical messengers flowing through a sophisticated network of vessels whose inner surfaces are metabolically alive. These inner cellular layers produce a gas molecule called nitric oxide, which tells your blood vessels to relax and expand. When nitric oxide generation is strong, vessels widen beautifully, blood moves effortlessly, and oxygen reaches your muscles, vital organs, and brain tissue efficiently. After crossing the 50-year threshold, 3 critical changes happen simultaneously. First, the enzyme responsible for creating nitric oxide becomes substantially less productive. Your vessels struggle to dilate on demand. Blood pressure climbs because your vessels can't soften and relax the way they once did. Second, your blood becomes incrementally thicker as red blood cells become less pliable and deformable. Thicker blood demands greater cardiac force to push through your microscopic capillary beds, especially those serving your hands, feet, and brain. Third, your overall blood plasma volume contracts. You're literally carrying proportionally less fluid in your circulatory network. Your kidneys become less capable of conserving water, and the neurological thirst signal that normally prompts you to drink becomes dulled. Millions of seniors exist in a constant state of mild dehydration without experiencing any thirst whatsoever. Plain water only addresses that third issue. It restores fluid volume, but it contributes absolutely nothing toward nitric oxide generation. It does virtually nothing for blood thickness except simple dilution. And when consumed without the correct companion minerals, it can actually wash away the electrolytes, specifically sodium, potassium, and magnesium, that control how effectively your vascular smooth muscle tightens and releases. The outcome? Hydrated by measurement, but not by biological function. The water enters your system, yet the circulation enhancement never materializes. Let me share a story about a patient I'll call Margaret. Margaret was 70 years old, a former accountant who prided herself on discipline and precision. She consumed exactly 10 glasses of plain water daily, documented meticulously in a smartphone app. She sought my help because of persistent symptoms her primary physician couldn't resolve over 18 months. Her extremities remained ice cold regardless of ambient temperature. She experienced crushing afternoon exhaustion that forced her into bed by 2 o'clock. She struggled with constant mental fog that made basic arithmetic, something she'd excelled at her entire career, feel impossibly difficult. Her cardiovascular tests came back normal. Her comprehensive metabolic panel showed nothing alarming. Multiple doctors assured her she was perfectly healthy. When I examined her hydration patterns closely, the problem became obvious within our first conversation. She was volumetrically saturated but functionally undercirculated. Her water consumption was textbook perfect. Her vascular signaling was completely broken. We'll return to Margaret's story because what happened in her life 8 weeks after implementing the protocol I'm about to reveal to you, particularly techniques 2 and 1, is something she described as reclaiming 15 years of vitality. Technique number 5: strategically timed temperature controlled water intake. This represents the foundation, completely free, absurdly simple, yet physiologically more significant than most realize. The temperature of the water you drink and precisely when you consume it relative to meals and movement directly impacts how rapidly it enters your bloodstream and how quickly it influences plasma volume and vascular responsiveness. Studies examining water absorption kinetics discovered that room temperature water, approximately 68 to 72 degrees Fahrenheit, gets absorbed substantially faster than ice cold water. Cold water triggers a protective constriction response in your digestive tract, slowing absorption while temporarily choking off blood flow to peripheral vessels. For seniors already battling diminished circulation, this brief constriction is actively harmful. Equally important, timing matters just as much as temperature. Consuming water during the 15-minute window before physical movement, even gentle walking, maximizes the plasma expansion benefit. When plasma volume peaks before activity begins, your heart pumps more efficiently, vessels dilate more completely, and circulation to your extremities improves measurably. Clinical trials on pre-activity hydration in elderly populations demonstrated that drinking 8 to 10 ounces of room temperature water 15 minutes before movement produced observable increases in peripheral circulation compared to drinking identical amounts immediately before or during the same activity. The practical application? Replace refrigerated water with room temperature water throughout your day and drink 1 glass 15 minutes before any planned movement, even a brief stroll around your home. This single modification costs nothing and requires zero preparation. Technique number 4: mineral fortified water. This is where the genuine mechanistic transformation begins. Plain water, consumed in substantial quantities, dilutes your serum electrolyte concentrations. Specifically, it reduces sodium, potassium, and magnesium levels in blood plasma. These three minerals aren't optional additions. They represent the electrical communication system governing vascular smooth muscle behavior. Potassium and magnesium function as direct vessel relaxers. They activate identical pathways that prescription calcium channel blockers target, using completely natural biological mechanisms. When plain water dilutes these minerals without replenishment, vessel tone increases. Your vessels remain slightly constricted instead of relaxing completely. The vessel lining becomes less responsive to flow triggered dilation signals. This mechanism explains why some seniors actually feel worse after dramatically increasing plain water intake. The solution is straightforward. Add a tiny pinch of unrefined sea salt, never processed table salt, which has been stripped of trace minerals, to every liter of water you consume. Natural sea salt contains minuscule amounts of over 80 different minerals, including potassium, magnesium, calcium, and zinc, alongside sodium chloride. This isn't about flooding your system with sodium. A single small pinch per liter elevates mineral content by a modest but biologically meaningful degree. Alternatively, incorporate a lemon wedge, which provides potassium and triggers a gentle alkalizing response that enhances vessel lining function. Or mix a small splash of pure coconut water into your daily hydration to naturally boost potassium levels. Research appearing in the Journal of Applied Physiology demonstrated that electrolyte enriched water produced significantly superior improvements in vascular conductance and exercise induced blood flow in older adults compared to plain water over a 14-day testing period. The vessels responded more readily. Peripheral circulation strengthened noticeably. The difference wasn't volume consumed, it was what the water contained. If you've watched this far, you're clearly committed. You want to discover what comes next. But most viewers consume this content and disappear without subscribing. If this information genuinely resonates with you, hit that subscribe button. It takes 1 second. If not, you'll likely forget this channel exists and miss tremendously valuable educational content moving forward. Technique number 3, tart cherry water infusion. Tart cherries represent one of the most thoroughly researched natural circulation enhancers in medical literature. Yet almost nobody consumes them specifically for vascular health. What almost nobody understands is that drinking them as a chilled infused water, slightly diluted rather than as concentrated juice, dramatically alters bioavailability and accelerates the therapeutic effect. The active compounds in tart cherries, particularly anthocyanins and polyphenolic acids, directly stimulate nitric oxide release in vessel lining cells. This addresses the missing component in the senior circulation puzzle. Plain water provides zero nitric oxide stimulus. Tart cherry water provides substantial stimulus. It activates the identical mechanism that numerous prescription vasodilators attempt to replicate synthetically. A controlled clinical trial published in the American Journal of Clinical Nutrition found that consuming tart cherry juice concentrate daily reduced arterial stiffness markers in older adults over a 12-week observation period. The confirmed mechanism was enhanced endothelial nitric oxide availability, the exact pathway that degrades with aging. A separate investigation documented acute circulation improvements within 45 minutes of consumption. Here's how to prepare tart cherry water for maximum circulatory advantage. Mix 2 tablespoons of unsweetened tart cherry concentrate available at most grocery stores into 16 ounces of room temperature water. Add a small pinch of sea salt and a quarter teaspoon of raw honey if desired for palatability. Consume 1 to 2 glasses daily, neither hot nor iced, at room temperature for optimal absorption. The rich crimson color indicates anthocyanin concentration. Deeper color means higher active compound levels. Target a deep ruby red, not pale pink. Technique number 2, early morning warm water with citrus and turmeric. This specific combination, consumed within 10 minutes of waking, exerts a disproportionately powerful effect on morning circulation, making it the second strongest technique on this countdown. Here's why morning timing is absolutely critical. Your cardiovascular system faces maximum vulnerability during the first 60 to 90 minutes after waking. Stress hormones surge dramatically. Blood thickness peaks after 7 to 8 hours without fluid intake. The tendency of blood platelets to stick together and form dangerous clumps reaches its daily maximum during these morning hours. This dangerous combination creates the highest cardiac event risk window in the entire 24-hour cycle. The majority of senior related circulatory catastrophes, including strokes, heart attacks, and blood clot events, cluster between 6 and 10 in the morning for precisely these reasons. Warm water immediately upon waking begins thinning your blood and restoring plasma volume before stress hormones peak dangerously. Adding fresh citrus juice provides vitamin C, a direct catalyst in nitric oxide production pathways, along with citric acid, which enhances iron absorption and supports healthy red blood cell formation. Fresh turmeric contributes curcumin compounds with documented anti-clotting properties comparable to low-dose aspirin in certain studies, without the stomach irritation side effects. Research published in the Journal of Cardiovascular Pharmacology found that curcumin consumption significantly reduced platelet clumping, the aggregation that escalates stroke and clot risk in healthy adults. The effect appeared dose-dependent and rapid, manifesting within 2 hours of consumption. The protocol is precise. Immediately upon waking, before coffee, before breakfast, before anything else, consume 8 ounces of warm, neither hot nor cold, water with the juice of 1/4 fresh orange or grapefruit and 1/4 teaspoon of freshly grated or quality powdered turmeric. Sip it slowly over 5 minutes. This isn't some wellness fad. This represents targeted vascular intervention using compounds your physiology already recognizes and utilizes efficiently. Technique number 1. Nitrate-loaded water paired with controlled breathing exercises. This stands as the most powerful technique on this countdown, the least widely known, and the one that most directly addresses the nitric oxide deficiency driving poor circulation after 50. Dietary nitrates from specific plant sources convert inside your body into nitric oxide through a sophisticated 2-stage process involving beneficial oral bacteria and stomach acid. The critical insight from recent medical research reveals that this conversion amplifies dramatically when synchronized with deep diaphragmatic breathing, specifically slow nasal breathing that activates your sinus cavities, which independently produce nitric oxide and regulate circulatory function. Here's the exact protocol. Dissolve 1 teaspoon of organic beetroot powder into 8 ounces of room temperature water with a small pinch of sea salt. Drink it gradually over 5 minutes. Immediately afterward, complete 5 cycles of controlled nasal breathing. Inhale through your nose for a 4 count. Hold gently for 2 counts. Exhale through your nose for a 6 count. This breathing rhythm stimulates sinus nitric oxide generation simultaneously with the dietary nitrate pathway, creating a synergistic vascular cascade effect. A landmark study published in the journal Hypertension demonstrated that dietary nitrate supplementation through beetroot consumption reduced blood pressure readings and enhanced peripheral blood flow within 3 hours in elderly participants. When synchronized with slow nasal breathing, documented in independent research to increase nasal nitric oxide output by up to 20-fold compared to mouth breathing, the combined vascular benefit substantially exceeds either intervention performed alone. The optimal timing for maximum impact is 30 minutes before physical activity or during the mid-afternoon energy dip when circulation naturally declines. This represents the window when the combined nitrate breathing protocol produces peak vessel dilation effects. You don't need expensive specialty beetroot products. A basic container of beetroot powder costs several dollars and lasts weeks. The breathing sequence requires 2 minutes. The combined effect on peripheral circulation to hands, feet, and brain becomes measurable within 30 minutes. I promised I'd return to Margaret's story. 8 weeks after introducing her to techniques 4 and 2, the mineral-fortified water consumed daily, and the morning warm citrus turmeric protocol, she returned for her follow-up appointment. She'd also incorporated tart cherry water 3 times weekly, more from experimentation than strict adherence. She hadn't modified her medications, her eating patterns, or her activity level in any substantial way. The frozen hands and feet that had tormented her for 18 months had vanished completely. Not improved, vanished. Her afternoon exhaustion had diminished so dramatically that she'd eliminated the daily rest period entirely. She told me she'd completed complex tax calculations for 5 uninterrupted hours, 2 days consecutively, something impossible for years. She said, I drank water religiously for 18 months and felt no different. You modified 3 details about how I consumed it, and my entire body transformed in 8 weeks. Why didn't anyone explain this sooner? That's the gap we're addressing. The scientific evidence exists. The clinical trials are published. But the standard 12-minute medical appointment isn't structured to explain the crucial difference between volumetric hydration and functional vascular hydration to an older patient. That's precisely what this video accomplishes. Let me synthesize everything. 5 hydration techniques ranked by circulatory impact for adults over 50. Number 5. Room temperature water consumed 15 minutes before activity. Number 4. Mineral-enhanced water with sea salt or citrus daily. Number 3. Tart cherry water 1 to 2 glasses daily at room temperature. Number 2. Morning warm water with citrus and turmeric within 10 minutes of waking. And number 1. Beetroot water synchronized with slow nasal breathing 30 minutes before activity or during afternoon energy dips. Begin with whichever feels most achievable. One modification applied consistently delivers more value than 5 modifications attempted briefly, then abandoned. If the only change you implement after watching this video is switching from cold to room temperature water and adding a pinch of sea salt, you've already fundamentally altered the functional hydration equation in your physiology. Which of these 5 will you implement first? Share your answer in the comments immediately. I read every single one. And if you know someone who drinks water constantly yet still battles cold hands, heavy legs, exhaustion, or mental fog, share this video with them now. The solution might be this straightforward. They deserve this knowledge. Subscribe for more honest, research-based discussions about what your body requires after 50. The critical information that doesn't fit into 12-minute appointments but transforms everything when it reaches the right person. Protect your circulation. It's delivering life to every cell in your body every second of every day. Provided the correct signals, it will respond powerfully. Disclaimer: all information presented in this video represents general educational content based on published research in hydration science, vascular biology, and geriatric medicine. This is not personalized medical advice. If you're currently managing high blood pressure, kidney disease, congestive heart failure, or any medical condition requiring fluid restriction or electrolyte monitoring, consult your physician before modifying your hydration practices. Your doctor understands your unique medical situation. This information provides a foundation for that discussion, not a replacement for professional medical guidance.